I'm going to add my welcome to George's to both the people in the room and the people viewing this through the live web stream. And as George described, the foundation for this roundtable is that the uneven distribution of health that we see in our country is the result of multiple forces from a wide variety of sectors that shape our life experience. And that although healthcare is a critical factor, social, economic, and physical exposures are the major influence on who gets sick and who stays healthy, on whose life ends prematurely and who leads a long and active life. And there are systematic inequities that determine who stays sick and who stays healthy. Alleviating poverty, changing school climates to increase the success of children who have been exposed to multiple adverse events or traumas in their lives, increasing social cohesion. These are not usually line items on a health budget. And the opportunity to have long-term, dependable, and adequate funding streams for creating safe, healthy, and equitable conditions in communities have not been priorities for most policymakers. Appropriations from federal and state agencies or grants from foundations can catalyze change, but rarely fund for the long haul or at scale, reducing their ability to have a major impact on population health. This roundtable has discussed a number of innovative potential funding mechanisms to change this, and we'll briefly review some of those later on today. This roundtable has also had multiple workshops in which we look at we bring a health lens to decisions made in other sectors to see what their implications are for health, say in education or housing or planning. And our goal was to bring that health equity lens to maximize the health that might result from those decisions. But our session today is going to take a different tack. We are turning to those other sectors to learn how they navigated achieving sustainable, systematic, dependable, adequate funding flows for their agendas. And although population health improvement was not at the top of their agendas, population health was not at the top of their agendas, our focus today is not on teasing out the health implications of their actions or the evidence of how those actions improve health, but on how they created long-term sustainable funding flows. They all have co-benefits for health, but our focus is on how they achieve that financing. So our map for the day will begin with a historical analysis of 4 case studies demonstrating how cross-sector policy and financing were applied to address major social determinants of health and equity. We will then turn to exemplars from 2 sectors, justice and energy. The leaders who will speak to us today will inspire you, and they'll bring their expertise into changing the flow of resources that will help us gain some better fiscal fluency in how to do this. Our speakers will discuss their strategies to align and accelerate flows of funds, how they modified current funding structures, and they'll talk about the opportunities and constraints they encountered along the way in creating these sustainable, dependable flows. In the health and healthcare context, we've talked about achieving savings and recapturing those for investment in more upstream causes. And there are some nascent mechanisms in that space. But compare this to justice, which actually has a field called justice reinvestment. Imagine if we could get there. And they use innovative and preventive methods to reduce detention and incarceration and reinvest those savings in further prevention at the federal, state, and local levels in both adult and juvenile justice. Similarly, clean and efficient energy financing interrupts the vicious cycle that drives people out of affordable housing as their energy costs go up, with multiple savings and co-benefits. Again, at the federal, state, and local level, the financing operates. So following these deeper dives in justice and energy will be a presentation that's outlined sort of a draft typology of many different types of funding mechanisms that we've discussed in the past and today, further increasing our fiscal fluency in thinking about how to get sustainable funding for population health improvement. And we want this to be a very interactive session. Chris Parker, member of the Planning Committee from the Georgia Health Policy Center, is a master at inducing this interchange. So Chris, I turn it over to you.